So we have just completed doing a lateral head impulse, and we want to go back and do LARP and RALP. So what you do is you want to click on the impulse tab. You want to choose LARP. We'll do LARP first. And now I'm going to turn the patient's head 30 to 40 degrees to the right. LARP is left anterior, right posterior. So when you had the head turned 30 to 40 degrees and you move the head down, you're activating the anterior canal, and when you move the head back, you're activating the posterior canal. You want to make sure that the patient can still see the dot. Once you get the patient's head turned, you want to reposition the ROI, the region of interest, so that the pupil is in the middle again, and click OK. You do not have to recalibrate, and now you're ready to start LARPs. You want to position your hand on the patient's chin, so make sure the patient shuts their mouth, and you want to position the other hand on the back of the head, or kind of right above the bump on the back of the head. And then you're going to do your head impulses downward for anterior and backward for posterior. Make sure the cable clip is not in your way when you position your hands. So you want to make sure that your data is matching up to the training curves. Okay, so once you've completed LARP, you want to then click Impulse Test again, choose RALP. So this is right anterior, left posterior. Turn the head to the left 30 to 40 degrees. For RALP, that's right anterior, left posterior. You move the head 30 to 40 degrees to the left side, you move the head down, that's the right anterior, you move the head back, and that's the left posterior. Reposition the ROI so that the pupil is in the center of the region of interest box. Click OK, and again, just like before, you do not need to recalibrate. And now you're ready to begin. Again, make sure that your data is matching up to the training curves. Okay, and then we finished doing lateral, LARP, which is left anterior, right posterior, and RALP, which is right anterior, left posterior.